Hi, I'm Larry Warren. I'm a director at Clear Passage Physical Therapy. Over the last 30 years, we've had so many women come to us with complaints of intercourse pain or decreased desire, arousal, lubrication, or orgasm that we ended up not only treating these conditions, but actually publishing studies along with a gynecologist who's chief of staff of a large hospital here in Gainesville, Florida, because we were helping these women so much, and for so many of them, they're told, there's nothing wrong, there's nothing I can do about it, have a glass of wine, just relax, everybody has pain, you're just growing older. No. We're not going to be looking to give you medications or give you lubricating gels. We're going to be looking for what's the cause of the pain? And truly begs the perfect question there. What is the cause of the pain? This is what we find. When any tissue is injured or inflamed or has an infection, even a subclinical infection, a vaginal infection that you didn't even know you had, or bladder or yeast infection, or you have a fall on your bottom, or you have rushed sex when you were younger, the body's first response to any of those is to lay down what are called adhesions. They're really internal scars, but when you look at them at a microscopic level, they are tiny strands of collagen, little threads like the threads of a nylon rope that come rushing in and start laying down at the area where the tissues have been injured to help isolate them so healing can take place. Once healing has taken place, those little strands tend to stay there. Once they've been there for 7 to 10 days, they're there for life. So if those strands form on the inner wall of the vagina, they can then it can tighten the area. It's kind of like a sheet laying down inside there, drawing things together so that when you're having intercourse with your partner, instead of feeling pleasure, it starts to pull. These strands have been estimated at 2,000 pounds a square inch. Yeah, they're microscopic. Do they show up? No, they don't even show up on X-ray, MRI, or CT scan because they're collagen. Collagen covers virtually every cell in the human body. So if they form at the entrance to your vagina, they can cause pain at the beginning of intercourse. If they form at your tailbone or cervix, deep within your vagina, they can cause pain with deep penetration. It feels like your husband or your partner is running into something. He is. He's running into your cervix or your tailbone, which has become curled forward by these crosslinks that have formed, not allowing it to get out of the way, to slide out of the way as it should when you're having intercourse. With your cervix, it can get quite stenosed. It can get these little crosslinks that happen actually between the muscle cells within your cervix. So your cervix tightens and it hardens some. It can be pulled to the side or to the forward or back. And when your partner runs into it, it hurts. What we started noticing when we were treating people that were coming to us with intercourse pain is we started having women call us back and saying, Larry, it's kind of embarrassing, but since I've gotten home, I'm having orgasms like I've never had before. And we said, is that okay? She said, yeah, but it's just been so unusual, I just had to tell you about it. After this happened about 10 or 15 times, we happened to mention it to the GYN, gynecologist, chief of staff of the hospital. He said, you're kidding, that's really important. And I said, it is? Yes, he said, that's so important. There's nothing in medicine that improves sexual function, and we can measure all of those things: desire, arousal, lubrication, orgasm, satisfaction, and pain. And they're pre and post treatment tests that we can give. So we published some studies on that, and I'll show you the results on that in a moment, or you can see them at our website. But when you think about it, the inside of your vagina is a warm, moist, dark environment. It is perfect for helping life grow. That life can include bacteria. When you have things going into you that may not be perfectly clean, you can get an infection, a subclinical infection. Your body's first response is, let me throw down some crosslinks because we've got some infection going on here. This bacteria is starting to grow in this warm, moist, dark environment. And let's lay these crosslinks down. So we get a net or a mesh of microscopic but very powerful crosslinks that form on the inner wall of the vagina. When we get in there and we can start pulling that net apart and taking it apart, it's like going back in time over the time that these crosslinks laid down. And when we do, not only does pain decrease, but so often desire, arousal, lubrication, and orgasm increases, and many people reporting first-time orgasms after we treated them because this happened to them at an early age. Whether it was a fall during athletics, they were roller skating as a kid, or they had a trauma, or maybe you're older and you've had a C-section or hysterectomy or another surgery, and adhesions have to form to help heal from that surgery. Those adhesions, once they formed, you don't actually need them anymore, except right where you were cut. The extra ones, as we free those up, well, let's just take a look at the results that we have in the two studies that we published here. This first study shows the results with a general population of improvements in all of those areas and general overall improvements. The second graph shows improvements just for women with endometriosis, who've been diagnosed with endometriosis. Numbers are really similar, you'll notice, in both of them. So these were not huge studies, but in all of the studies we published, and we've just published one with almost 1,400 women for infertility, and we're publishing really large studies, but they pretty much followed what our initial pilot studies have shown. And so if you have questions, that's what we think is going on with intercourse pain and with decreased sexual function, and that's how we think we're helping it. If you have questions, give us a call. Okay, thanks.